that.
Great, thank you, Trini. Yes, we for anyone new, we record the presentation portion only of these meetings. So you are all set, Tracy. The floor is yours.
Except I don't have screen sharing available.
Don't. Okay, so
Let me do that,
we
please.
need our host to be able to let
Ellen,
you.
give me 1 second, Tracy. Sorry about that.
Okay.
Tracy, could you kindly try again and see if you
Got it.
able to share? Super.
Okay. Can everyone see that?
Yes.
See if I can, okay. So good morning, everyone. Good to see you. And as many of you know, over the last couple of years, we've talked about this issue of racism as a public health crisis. And in fact, out of this group, different people started discussing maybe we should start working on our own declaration. And people from this group and from other groups decided to do that. So going to let you know what we have worked on over the last year or so. Okay. There we go. It was something has to go wrong computer wise, right? A lot of this information is not going to come as any surprise to you. A lot of these slides are going to look at the disparities in health and the real equity issues that are involved. We have looked at research from around the country. This information comes from US Vital Statistics. It's from 2015, but a lot of it still applies. And you look at major illnesses, and there's huge disparities at all age levels for African Americans. You look at high blood pressure, diabetes, and stroke, much higher incidence of that in that population. And now I have to remember how I just changed the slide. So life expectancies are vastly different. If you look at African American men alone, their life expectancy is 70 years compared to Caucasian/white American males. We also know this, that Black women across socioeconomic status are much more likely than white women to die within 1 year of childbirth. And you probably also know that there's that Black babies are more likely to die before they reach their first birthday than white babies by a significant amount. And complications with birth, children dying at birth, all those factors come in. And then if you look at the COVID-19 death rates, African American, Native American, Alaskan Natives, Hispanic Americans, triple the death rates compared to whites. So we've been looking at all this, and also at this concept of weathering, and we've really spent time looking at what happens when you live in an environment where you have structural racism affecting your life on a daily basis, and how that affects your health. And of course, and again, I know you folks know most of this. Well, you probably know all of it. Accelerated aging, increased risk of chronic diseases. It's just not good no matter how you look at it. And now I have to, sorry. I apologize for what I'm doing. The little gallery here is kind of, oh, there we go, getting in the way of what I can see. And we also know that these health disparities are driven by social and economic inequities. You look across all these various factors, and when we talk about social determinants of health, and the effects are devastating for people of color. So if you look again nationally, and this is for African Americans, unemployment, living in poverty, home ownership, which is huge, and of course the wealth generation that comes from that, access to medical care, specifically MDs in this case, all these factors come in as well. But what do you do when you live in a state where you have people high up in government who say, there's no such thing as systemic racism. This isn't a problem. It doesn't occur here. New Hampshire is unique. We have the New Hampshire advantage. We don't have to worry about this. And as a matter of fact, since we don't have to worry about this, you can't even talk about it if you work for the state or in education. So what do we see in New Hampshire and Manchester? Well, we see the same things you see nationally. This looks at median household income, per capita income, and you go across there and you see the differences as we start moving away from white folks. The only in terms of income, the only group of people of color that come closer are Asians. Otherwise, those of Asian descent, Asian Americans, and then if you look at all other races, white folks are out there in front. And if you look at poverty rates in New Hampshire, yes, there's poverty for white people, and that keeps getting thrown up whenever we try to talk about this with people. But of course, as we know, higher levels of poverty for people of color as well. So what about Manchester? So if you look at Manchester, and this looks at different census tracts in Manchester, you see higher levels of poverty. And these are the households where they have higher percentages of a non-white householder and much higher levels of poverty in Manchester. And some of these, as you can see, are also from Nashua and Dover, but a number of them are from Manchester, and all the Manchester ones. Oh, and I should say that for our declaration, we decided to start with Manchester, and I'll talk more about that in a minute. We doing okay? Is everybody okay with all the information so far? I don't want to move too fast or too slow. I know I'm on a time limit here, and I forgot to actually look to what I started, but so again, with New Hampshire, you look at housing problems, and much higher percentages of housing problems. The blue ones are one or more housing problems, like not having complete kitchen facilities, not having complete plumbing. And then you look at severe housing problems, which includes things like housing costs more than 50% of your income. And you see much higher levels of difficulty for people of color there as well. One of the things we also get asked, and this is more specific to Manchester, some reflected in the previous slide, but also in some of the information you're about to see, is okay, so that was national stuff. Yeah, that's New Hampshire, but what about Manchester? So we get to Manchester, and here's what we see there. You have historical redlining, which started out with Irish and other immigrants who came to work in the mills, but now people of color have been kind of guided into those poorer neighborhoods with higher levels of lead paint, higher levels of asbestos. And if you look at the housing conditions in 7 of the different census tracts in Manchester, and this is in the center city, you have severely crowded housing conditions, which basically boils down to 3 to 10 people per room. And then high crowding conditions, that's the 1.6 to 2.7 per room. And the worst in the city is in 5 of those tracts in the center city. We also have higher extreme poverty in 8 census tracts in Manchester, with 2 qualifying as persistent poverty. And while we speak about poverty, since 1990, it has quadrupled in Manchester, according to all the data that's out there. That's from the US Census. And the highest relative levels of unhealthy outcomes are in 5 tracts that have these higher levels of poverty. You know, you can see there the 2 others of these have the worst outcomes. And there are a number of other, we didn't get everything put into this slide. There's a lot of other stuff about Manchester that looks really bad. And there's the difference in life expectancy, that it fits exactly with the national life expectancy. It's a 70 years life expectancy compared to 77, and also lower levels of prenatal care. And then in terms of access and delivery of healthcare, all these factors come into, and all of us who are part of this equity task force talk to people about these things on a regular basis. Difficulty in getting insurance, and especially with the ending of that Medicaid extension, scrambling to try to keep people on Medicaid, distance, trying to get to clinics and hospitals, language barriers, of course. And this isn't to say that people aren't trying to deal with this, because at Amoskeag, of course, they think they cover something like, the last I talked to them was like 74 different languages. There are people out there trying to do this, but you can't count on that at all healthcare facilities. Insensitivity, cultural differences, we've all heard those stories as well. And then you get to delivery, and again, language, communication, access, cultural competence. All of these factors, including, and this isn't necessarily something that Manchester specifically can do, but also, as you know, how racist ideas affect diagnosis and treatment, and how there are still factors like the different algorithms that are used for diagnosis of kidney problems with African Americans compared to white Americans. Differences in both training and beliefs of medical personnel about how Black and brown folks experience pain compared to white people, or the differences, like in almost no medical training in dermatology do they use brown skin as an example of how do you treat skin illness or skin disease. It is primarily white skin used as an example. So when Black and brown patients go into dermatologist's office, very often they have difficulty recognizing if there's a problem there. So nationally, as of a couple of weeks ago, we have 256 declarations of racism as a public health crisis in the United States, and that's at all levels of government. And as you probably heard before, 3 states east of the Mississippi have no declarations at any level: Louisiana, South Carolina, and New Hampshire. And that comes from the American Public Health Association. I was just at a webinar yesterday, and they reaffirmed the 256. There's an APHA representative there. So we started thinking about, what do we do with this, and what does it take to have a declaration that's going to mean something? And the Network for Public Health Law is part of a larger coalition of organizations around the nation, Salute America and a number of others. Their acronym is CARE, and it's a coalition, Coalition for Action on Racial Equity. And there are all these healthcare organizations or legal organizations that have come together to talk about, how do we make a difference here? How can we help out the people that are trying to do the work right now have a better chance of making that work succeed? So they have suggested these declarations and have said that these are the sorts of things in the declarations that are more likely to really make a difference. We don't want just something that's performative. We want something that's going to matter. and have some teeth to it. And of course, collection of data is important, and we know the difficulty in that. Accountability mechanisms, offices and task forces, and importantly, getting the community involved in it, and then having money involved with it also. In Manchester, we have a health department that has worked really hard for years to do all that it could to make sure they address these issues, and everything from the community schools to multilingual community health workers. I don't know if you're all familiar with the Fresh Choice program. It's a fairly new program that the health department, ORIS, and anyway, they've worked out a plan to provide fresh fruits and vegetables into the smaller stores and the corner stores in the food deserts in Manchester, so people can get fresh produce. And we were really happy to hear about this, because as part of our work, we had just sent a question out into the community: what's the one thing that would help your health and your family's health? And two things came up. One was better jobs, but the other one was good food, fresh food. That's what they wanted. And so this Fresh Choice program, we were thrilled to hear about this. Anna and those folks have done just terrific work there. And of course, there's a Wellness on Wheels program that's going around into communities and offering health information. Oh, and their vaccine efforts as well, since we're talking about COVID equity. So in Manchester, historically, a lot of folks have wanted a declaration to happen, and we figured, okay, it's time to get this done. So we formed a work group that has members from a number of different areas. We have a number of people of color, people representing the immigrant and refugee community, the Native American community. We have healthcare providers, people from public health, from nursing school. The Manchester Health Department sits in periodically. And of course, the Manchester Community Action Coalition, American Civil Liberties Union. We have an alderman that's involved, and the NAACP is represented by me, and have come together and worked on this. We started talking about this last summer, and we wanted to wait until after the elections, and started meeting back in January, and have been working on a declaration. We spent time researching declarations around the country, reading through what different cities, localities, states had done, and tried to look specifically at cities, municipalities around Manchester's size, so it would fit more with New Hampshire, and also more the ethnic makeup of Manchester. We gathered data about Manchester and New Hampshire, as you've seen already. Spent time talking with community members. We want to do more of that, and we're finalizing the declaration now. And also, what we want to do is seek a broader coalition of support. We want to get more people involved in this as we take it forward, trying to highlight the progress that's happened and spur action on what needs to get done. This is where the shameless pitch comes in, where we're going to say, it's sort of like when you see those old posters of Uncle Sam where he points and says, "We need you. We need your support." And we also recognize that for a lot of you, if you're involved with the state organization, you're bound to not speak about this, because this is a problem that doesn't exist, according to that law. But need your help or your support, or any help you can give us in any possible way. What we have done, well, our goal is to have action, community involvement at all levels, and measurable results. And we want to have funding tied to this. There's data, there's 19 clauses. The whereases, we just have a couple of them, the first couple of them listed there. But the whereases go down and just outline the problem with data and references. And then we have 20 resolutions for things such as an Office of Health Equity. Pardon me, an equity officer for the city. And and not just some figurehead that's going to sit there, but somebody who actually can do some things. And then there are other things like training and community involvement, community members involved in all of this, actively involved in what happens in the community. At the webinar I was at yesterday, they talked about how in Chicago and some other cities that funding requests they do, what do they call it? Community-based funding, where they have community members come in and sit in on all the funding decisions and have an active voice and a vote. It's not just city council members or aldermen or whomever, but this is a part of their process. So this is what we're working on, and we'd like you to join us. And if you have any interest, and it's not like you have to go out, if you're in a state job, we're not asking you to go put your neck on the line. But if you can think of resources or you have ideas about what might help out, anything like that, there's my email address. I'll put it in the chat also. You can contact me. I'll get back to you. Just say and you don't even have to write out the whole thing. You can just put RPHC in the title line, or what is it, the subject line, and I'll know what it's about, and I will get back to you. Now, having said that, my wife and I go on vacation tomorrow, so you might not hear back for a week, but I will get back to you, and we will welcome any help you can offer, any resources you know about, or even if you know somebody in the community that would like to come to us and talk about some problem they had that they would like people to understand, or some way they could, get recognized. And I see Deb has her hand up, so I will stop sharing unless anybody wants to go back and see anything. And do I need to give you back the right to, oops.
You're all set, Tracy.
So okay.
Tracy, I love these declarations, but I'm finding that while you're focusing on African Americans, the disability community has the same problem. And
I'll recognize Deb.
I'm wondering how we can make these declarations, as you say, not performative, but bring recognition at the same time to that community, because disabled community in the African American community, especially in Manchester, is undercounted and does not necessarily join the disability groups that are out there for advocation. So that's my question. I mean, I'm not criticizing your work. I'm just saying how we can get this done. So
No, agree with you on that. Actually, we've gone back and forth about the name of the declaration and what we want to do with it, because one of the other ones we talked about is, should you, instead of making it racism as a public health crisis, should it be racism and stigma? Because certainly there's a lot of stigma around disability as well. And then if you have the intersection of stigma and race, that creates additional problems. So certainly willing to look at that.
Maybe we should connect about that, Tracy, after your vacation.
Happy to, Deb.
Tracy, I have a question. Well, first, thank you for that presentation. That was really interesting. And are you looking for people and organizations to sign on who are either living or working in Manchester, or are you sort of looking for other people outside of Manchester as well?
Yes.
Understood. Thanks.
Yeah, among others, we will go out to the guilds, for instance, with behavioral health. We've identified different organizations that we want to specifically reach out to. So if it's mental health issues, yes, we could go the Manchester Mental Health, but there are also all the mental health guilds. The Psychological Association, Marriage and Family Therapy, counselors, etc., reaching out to them as well. And those are statewide organizations. And and when it gets down to the politics of it in Manchester, when it gets down to the politics of it in Manchester, the Board of Aldermen will mainly listen to people who are from Manchester. But having the support of other folks, especially if it's something like, it's a medical society, or if it's psychologists, etc., that can make a difference. Also, having said this, as most of you know, we're starting with Manchester, and we hope to take this to then other cities in the state, and eventually go at this at a state level. So we started with Manchester, and we'll move on from there. So hopefully that answered your question, Kirsten.
It did. Thank you.
Can I just add a comment that, this separate group was sort of birthed out of conversations here, right? We had a number of discussions about would NHPHA, who was leading on some kind of an effort to explore this declaration phenomena, and is it something we could do here? And so Tracy, as Manchester NAACP Health Subcommittee or Committee Chair, offered to begin to host those conversations. And so there's a number of people who are participants here who just started meeting, and other people also joined in, and that's an open group. People are welcome to participate.
Yes.
And we want to, we focused on Manchester because that's who was present, right? And so it's not so much that we want to export it everywhere around New Hampshire. It's just, wouldn't it be wonderful if we could have more similar efforts? Sorry. In other communities, the whole state. But for now, we started with our sphere of influence, which is Manchester.
Oh, hi, Anna.
How are you?
Right, thanks.
Sorry, I'm just going to jump in. I have to get my video going. So, hi, everybody. Unfortunately, I can't make a lot of these meetings, like a lot of us are just all over the place. But I feel the need to speak to this a little bit, just because we've had a lot of discussions about, how does this really launch in a community of this size? And I will just tell you that I've researched these declarations as just like everyone else has ad nauseum. I've attended all different kinds of webinars, and I think there has to be a little bit of a balance in how we tackle it as a state, because I certainly don't feel making a declaration for the city of Manchester is going to affect the change we want to see. So this is where, we can make all the declarations we want, but until they're linked to action and you have really committed action to it, what I have seen is they really don't mean a lot. There has to be a committed action to it. So I think there's got to be a lot of groundwork that has to be covered first before you try to bring this in front of a city leadership, is my recommendation, because you need the buy-in from the city leaders. And especially if you're looking for money, they're going to want to have strong evidence that this is needed and understand it. And this is sort of the choir. You all understand the value of these things and how these have been rolled out in other cities. But I will just tell you, just from my experience, there's not a big following outside of the people who do this work on a regular basis, unfortunately. So there's a lot of education that still needs to happen. I think, when I have talked to our mayor about this, there's lots of questions about, well, why would we declare racism as a public health crisis when we've never declared anything else a public health crisis other than COVID, in our generation. And there will be pushback because people will say, well, why is racism more important than people experiencing homelessness or, our addiction crisis? Like, people pit issues against each other. And I think we have to be very strategic about how you roll these things out. And you want to get people, I've seen these things backfire as well in some communities, because it's almost accusing a community of being racist by saying, well, we have a crisis here because we're not doing anything to counter racism in a community. And I can't, I will tell you, just as a city and all that we've done as a community, and I appreciate the props that you gave to our department, but I'd even go beyond that. I think we are a really strong city as far as trying to be inclusive, trying to be respectful of each other. I mean, I will tell you, as city government, every single employee is required to go through inclusion and diversity training. I mean, we have an equity officer in the district, so there's lots of movement in the city that is afoot, which I would argue does not happen in a lot of communities in the state of New Hampshire. And it's not to attack other communities, but I'll just tell you that we have a long history in this city of celebrating our diversity, and we continue to do so. So it will be a tough road to try to get our policymakers to then say, well, we have to make this declaration. And I think one of the ways we can approach it, and I'm struggling with it, to be honest with you, because I think, and I like this idea of a more holistic approach, that I think the bigger topic at hand is this notion of health equity. And people are experiencing health disparities, not just because of the color of their skin, as you know. There's other large influences and certainly subpopulations that we're seeing that also need a voice. So I think we need help in how to roll this out in a very, I think, tough state and tough city who will have resistance to this. And what I have seen work best is when you try to roll this out in a way that everyone can see themselves in the campaign. So you have to get people to want to care about this. You can't guilt them into it. You can't force them into it. You really want their genuine buy-in. And that takes a lot of groundwork, which I don't believe has happened yet. I will just tell you that if we bring a declaration in front of this city now, I don't know if it would pass. I don't know if it would be adopted. And it's not that people don't, they're not saying that racism doesn't exist. I just think the notion of putting a declaration out there that it's a public health crisis, when we've not done anything like that before in the city, and not having it linked to any action, will probably be the biggest pushback. And we're not alone in that. This is what has happened in a lot of other states, a lot of other communities. Many of these declarations came out of communities, unfortunately, where there was significant events that occurred before they passed the declaration. So I don't know, it disappoints me that we don't see the state of New Hampshire passing a declaration. It disappoints me that there aren't more communities doing it. It disappoints me that, we don't push it through other mechanisms like the Public Health Association or DHHS. Like, why is that not happening? And why is it that we're starting with the city of Manchester that I don't even know if it's going to happen here? And just as another footnote, we have a partnership with all of the hospitals and healthcare organizations, and we're going to be rolling out a new needs assessment that has all updated data from what you just presented. So I kind of wish I knew that you were going to do this, because we could have given you some of that. And I think we need a fresh set of eyes on these things as issues, but as a collaborative, I think this has to be a healthy conversation. Why are these things not happening statewide? We understand those barriers. And if we're going to truly be committed to combating racism, then why is it only happening in one city? Because we can't just declare it in Manchester And then when people step out of Manchester, then they're going to face racism everywhere else. Like, it has to be a global effort in more of a statewide influence. And I don't know how to affect that change. I'm just saying that I have just seen the resistance. I've heard the resistance from people because I think they would rather have an action plan that shows, well, what is it that you want to see done differently? Give me the tangibles that you want to see done differently. And I think that's probably a better lead to kind of convince people of what's missing and what do you want to see. And then they can understand, oh, okay, that makes sense. Where right now, I don't think people see it. And not everyone. I'm just saying the ones that you're trying to get to adopt this. I think there's a huge education that still needs to take place. And that's not going to happen overnight. I think we still have a lot of groundwork to do. And it's just my 2 cents because I kind of feel the need to speak to that just because, well, I am the public health director of Manchester. So, you know, if we're going to declare a public health crisis, then I certainly have to be behind it 100%. And I'm not opposed to it. I'm trying to caution everyone that there's a lot at play. And that's sometimes bringing these forward is a healthy tension. Like, and honestly, like sometimes go ahead and test it, throw it in front of the mayor and board of aldermen, make them have this conversation. But it's a big risk because what could easily happen is you're going to lose some of those people that you may have been able to garner along in partnership. So it's a risk. It could force an agenda, but it may not lead you to the outcome you want to see. So I think we got to be thoughtful about these things because they have implications. And I've been at this game for 28 years, so I know the politics of a city this size, and I've had to deal with lots of policymakers over the years. And I just feel like there's got to be some more groundwork under play here before you give it a go, because I don't want it to take us back steps. This is clearly something we want to advance. And I'm a little worried. I'm just telling you that I think you'll see some resistance, and I think we still have some groundwork to do. So I kind of felt like I needed to speak up, and I apologize because I don't want to sound like Debbie Downer by any means. I'm actually just the opposite of this. I want this to be successful. I want it to lead to the change we want to see. I just feel like we have a lot of work to do to get there.
I agree with you completely. That's the stage we're moving into. We've worked on the draft so that when we go to people, we can talk to them to see about building the rest of that groundwork, really getting the community involved, and also getting feedback about it. For those of you who don't know, Anna has attended meetings. She's given us an awful lot of information. Victoria has also attended meetings, and we've tried to communicate back and forth about what we've done along the way here. So yes, we want to build up as much community support and get buy-in as much as possible before it goes before the alderman. And I also agree this should happen universally. I'll just speak from Manchester NAACP. We get constrained by our area of influence by the larger NAACP. So I had to start with Manchester if I'm working on this, and we're working with the New England organization that we can then work for the state. Sorry, Rick.
Tracy, thanks. I hear Anna saying something kind of different, that a more effective approach would be to develop a health equity action plan that would really focus on the changes that we need and opportunities for improvement rather than a declaration. And Anna, that really was helpful to me because I've never been convinced that a declaration would have a positive impact. We know how many there are, but we don't know what they've done, or at least from the stats you presented, Tracy. I'm not convinced that any of those 256 have made a difference. Maybe they have. They get people talking about the issue, and that's useful. But I think a positive plan or developing a positive plan might be more effective?
Well, in part of the declaration, so we have all the whereases, and then there are 20 action steps um, for things that would happen. Everything from an equity officer to, oh gee, I'm trying to remember out of the 20, all the different ones, and I don't have them in front of me. And that's where, when as we go to folks about this, um, I think in many respects it could get seen as a health equity action plan, and again, that's hearing from other people as well, because that I think I said before that it would involve community involvement, where people in the community actually have a say, where there's data collection. It's like when I showed the thing from the Network for Public Health Law, we went down that and tried to make sure that we had those kind of action steps in there that we could present to people. And as for the effects in communities, the webinar I was at yesterday they talked about that. They had people from the communities where they've had success and what has happened in those communities and the differences that it made, and also how they gather data, what helps make it successful going forward as well. So I found that helpful as well, and they had some other resources to access that information, as well as when we however this goes forward, somebody's going to ask us, well, what's this going to cost us? So that's a part of it too, being able to say, well, if you do this, likely here's the dollars and cents that are going to be involved.
This is Debbie. In your action plan, Tracy, is there, because the huge piece that's always missing is education in communities. And as I'm doing some work for the DRC and getting in communities and using some of my contacts that already exist, there's a lot of previously what I call the smile, the nod of the head, and you will not see them again.
Yeah.
So, my question is, as always, are the right community leaders or the right people going into the communities versus someone that they just say hi to? Do you understand what I'm saying? And that is always such a hard judgment call.
Yeah.
So are those evaluations happening? I mean, let's be realistic. If you don't have community buy-in, this will not be affected. It doesn't matter how much racism is going on.
Yep.
It's I can speak for myself as a Black woman. You learn how to deal with it and you keep moving. So how does this effectively help not help the community, but educate the community so that they understand that this is their plan and they can make changes to this plan? These are just suggestions. So how are you getting their buy-in?
Yeah. No, I think that's absolutely key. Have to get out there and talk to people. I didn't get value, Kirsten had the question at the beginning, what's the primary value here that we hold? What do you look for in other people? And I will say for me, it's safety. And this comes strictly from my work that I know, because I worked in mental health for 47 years, and if people did not feel safe, they weren't going to talk. And I think that's just universal. If we don't get that sense that the person I'm talking to is safe, nothing's going to happen. I'm going to be too cautious, not going to really share what's going on here. And I think we need to really pay attention to that. And it doesn't matter who we're talking to, if it's somebody in the community who's living in horrible housing conditions, or if it's a cop and we're trying to talk to them about their experiences out there, or a healthcare worker, they have to feel safe with the people they're talking to, and we have to make those connections, because that's safety. And then the other thing I would say is my primary value is connection. Making those connections and making meaningful connections that we can, so people can say, as Rick and Anna have talked about, where we have real buy-in, this has to matter. One of the things when we started this work, we had discussions at the very beginning about why does this matter to you? Because we wanted to see in our group working on this, what's the importance of this in your life and how does this reflect your values? So people had buy-in about just working on the declaration and the action that goes with it.
Deb, I would add on that Anna joined us at one of our earlier meetings, and we really talked extensively about what we need to be asking for, right, when in the recommendations is making sure that there is robust community engagement in many ways, right? That's what creates a healthier community. So that needs to be part of the process, and it needs to be the desired, key part of what the outcomes that we seek. Whether we, call it a declaration or call it a plan, an action plan. I think, we brought it here because this is where some of the original conversations were had. And again, people are welcome to join in the effort, right? So this is just one of the, I think Tracy presented to the NAACP general meeting, and then this is the next one. So it's not like we have a roadshow that we're doing. It's really just having the conversations. And so this is a forum for conversations on this kind of a topic. So I hope people will reach out. If you're interested in joining, you can come to our meetings. If you want to, offer additional comments, please. This is meant to be a community effort. And I agree wholeheartedly, Anna, we've talked about this a number of times. There were efforts made multiple times to see DHHS lead on this. NHPHA has at times shared with us here, where they were at with, I know they've had conversations about whether or not they would lead. I don't know if Hanan's able to speak to that today about sort of what NHPA is currently thinking about this. So wouldn't it be wonderful for us to have a statewide effort? But again, like we're in Manchester, and that's where we started. Hopefully we can get something positive and helpful.
Thank you, Trini. The New Hampshire Public Health Association, one of their efforts, I think, started last year before I came on board, where they adopted DEI, diversity, equity, and inclusion into their bylaws. And one of the things that I'm trying to work on right now is to put a DEI committee to help to guide us as an association to integrate DI into the organization governance, into organization operation, and also parallel to that, do a series of educational sessions, raise awareness about DI, give examples about what's going on in New Hampshire. And Tracy, thank you for sharing this information with us. We would love to work with you. I agree with everybody that this should be, we should put together a plan and get buy-in from the community. I think that's the best approach to really have good, positive results.
Thanks. Happy to talk.
Okay, thank you, Tracy, and thank you everyone who participated in the discussion. I will say that like all of you, I've watched this issue pretty closely across the country over the last years, and I have to admit, I've struggled a little between where's the line between performative and substantive, and how do you land on the right side of that line? And I will say, when the discussion started here, I did, prior to leaving a DHHS, I did push this up to leadership several times as a request. And, I'm not going to make any assumptions about why it didn't go anywhere, but it clearly didn't go anywhere. And so I was really happy to see Manchester sort of begin this effort. And I've wondered too, and maybe some of you have wondered as well. I've wondered too, like, what does is it more effective when it's a smaller, like a municipality or a town or a smaller location that takes on this effort and is really able to engage effectively, you know, on the ground community members in the process, as opposed to a state making a declaration, which may be very performative in and of itself. I say performative, but I think we all know it's still impactful to say out loud the things that that we should say. And so anyhow, I'm really interested in what you're doing, and I really appreciate Tracy. I think I'm not sure exactly, I can't quote it exactly, but you said something that really struck me, which was really referencing that the process of bringing people together and talking about the issue and talking about the potential of a declaration is valuable in and of itself. And I think that that's like, that's like the lesson of public health in general, right? The process is almost always as valuable as the outcome. So, so good luck. And I'm sure hopefully several, if not all of everyone here will get involved in some way.
Thanks.
Okay, so